On behalf of the Center for Occupational and Environmental Health and the California El Camino Real Association of Occupational Health Nurses, I would like to welcome you to our webinar, Workplace Preparation for Wildfire Smoke Health Concerns, presented by Anne Katten, MPH. At this time, I'm pleased to introduce Julia Bess, PhD, RN, and a member of CCRON, who helped to coordinate this webinar. Thank you so much.
Thank you, Michelle, and thank you very much to CREH for hosting this webinar for us. As mentioned, my name is Julia Bass, and I'm a member of the California El Camino Real Association of Occupational Health Nurses, which is commonly referred to as CCRON. CCRON is the regional professional association serving occupational health nurses in Northern California. You can find out more about us and how to join us at ccron.nursingnetwork.com. We have various educational events throughout the year, and upcoming is actually our state Occupational Health Nurses Association annual 3-day conference in Sacramento. There's details about that on our website too. So at this time, I'm very pleased to be able to introduce our presenter today for this important webinar on workplace preparation for wildfire smoke health concerns. Our presenter today is Anne Katten. She is the Pesticide and Work Safety Project Director with the California Rural Legal Assistance Foundation. And there in that role, she advocates for improved enforcement and policy changes to reduce exposure of farm workers to pesticides and other work hazards. She's been involved in Cal OSHA advisory committees on many issues, for example, heat stress, ergonomics, fracture and lattice safety. She holds a master's in public health degree with an industrial hygiene emphasis from the University of California at Berkeley. So very pleased to have such a knowledgeable advocate to share with us today. So thank you for joining us, and I'd like to hand over to our presenter now.
Hi, this is Anne. Hello?
Yes, Anne, I can hear you loud and clear.
Oh, sorry, I wasn't sure about the meet. Hi, I'm Anne Katten. Thank you all very much for joining. And I have no conflicts to disclose on this matter. Today we are going to cover employer responsibilities for protecting employees from wildfire smoke exposure, some background information about the air quality index for small particles, PM2.5, which are the predominant pollutant from wildfire smoke, Appendix B of the emergency standard, and some guidance on how to recognize farm workers' concerns and special training needs when doing training. California Rural Legal Assistance Foundation, along with the California Labor Federation and WorkSafe, petitioned the OSHA Standards Board last December for development of a standard based on the air quality index to protect outdoor workers from wildfire smoke. We did this because in recent years we saw farm workers, day laborers, construction workers working outside during the wildfires and saw they needed protection, of course. The emergency standard was developed on a very, as an emergency standard on a very tight timeline. It was put in place at the end of July after a rulemaking process where comment and input were taken from various stakeholders. And this is you can find a copy of the proposed and final text here. This is a temporary standard. In current form, it will expire in the middle of January unless it is renewed or a permanent standard is put in place. And the anyway, so that's the, and it can be renewed up to one time. So in current form, it could be up to 1 year in place, and then a permanent standard would need to be in place. And the outdoor heat standard was developed by through this same process. The standard applies to workplaces where the air quality index for fine particulate matter is 151 or greater, which is the level that is considered unhealthful for all the population. And this applies for workers who are exposed at least an hour a day. And it applies to both indoor and outdoor workers. But if workers are working in a closed vehicle or building that has filtered air, they don't have to be provided with respiratory protection. The standard is based on the PM 2.5 fine particulate levels, because that is the predominant pollutant from wildfire smoke, and because it is it is constantly monitored at a lot of government stations, but we also, of course, recognize there are a lot of other pollutants in wildfire smoke that can have a health impact. Okay, and for more background, the air quality index, which it's an index that was developed by US EPA to provide a real-time air quality information on ozone, PM10, and PM 2.5 levels throughout the country from a network of air monitoring stations. And when there is a large wildfire in process, additional mobile stations are generally added to the area. And the levels can be checked on a website called airnow.gov by zip code. So it's easy information to access. And they are, the current level is a rolling average, I think based on 24 hours with 24-hour rolling average with some weightings. Okay. Other requirements, in this standard, employers have to check the levels of when you are reasonable to suspect that there is wildfire smoke in an area. They need to check levels before each shift and periodically during work shifts to see what the levels of PM 2.5 are. And then exposures to wildfire smoke need to reduce to the extent feasible by relocating work to an enclosed building or vehicle where the air is filtered, or to another outdoor location where the air quality is healthier. And if employers can't reduce workers' exposure adequately through these engineering and administrative controls, then they need to provide respirators, such as most commonly an N95 type respirator for all employees for voluntary use, along with training on the requirements of the regulation, health effects of exposure to wildfire smoke, and how to safely use and maintain a respirator, and what the limitations of uses of respirators are. And when the air level for PM 2.5 during a fire reaches 500, which is the upper limit of the hazardous scale, respirator use is mandatory. And the advocate, those of us who filed the petition, we feel that the level for mandatory use should be 300, which is the lower level of hazardous, but we can discuss that in more detail later. These are just examples of some types of N95 respirators. The most common type used by outdoor workers would be the one on the right, but without a valve. The different styles of respirators fit different shapes of face better or worse. And for voluntary use, there is not a set obligation to provide multiple styles, but it's really a best practice to make sure that everyone can have a respirator that is protective. The wildfire smoke regulation has an appendix that is intended to be used as a guide for training, for the content for the training that's required. But it's not simply, providing copies of the appendix is not an adequate way to do training. Anyway, and the appendix and the different content that is supposed to be included in training includes explaining the health effects of wildfire smoke exposure and different health conditions that can make people more sensitive to wildfire smoke, the right of workers to obtain medical treatment without fear of reprisal, and the responsibility for employers to provide prompt transportation to medical treatment, how to find the AQI for PM 2.5, or how to ask the employer for it if there isn't any internet access at the work site, the general requirements of the regulation, the employer system for how they both communicate information to workers, such as if the air level, the smoke level is getting worse, or if workers perceive that the smoke level is getting worse or are experiencing symptoms. The methods that the employers planning to use to control exposure, relocation to an indoor site or to another site further from the smoke, or respirator use. And then finally, the part that really takes the most time in the training, the benefits and limitations of using a respirator and how to don the respirator, when it needs to be changed, and how to judge if you may not, it may not be helpful for you to wear a respirator. The appendix includes this graphic, which is a nice clear graphic that shows, some of the important things to consider about placement of the respirator on your face, that it seals better if facial hair is shaven around the seal, and how to check, and that the face seal needs to be checked. Of course, not all N95s have a nose clip, so that's something to keep in mind. We also strongly recommend that people, workers are trained to check for the NIOSH seal that's generally on the middle of the respirator, because some subcontractors and small employers may be providing dust masks that aren't really respirators, either out of ignorance or cost cutting. And so it's really important for workers to know how to check whether they're getting the genuine article that will be protective. Here I've provided a link to the regulation, which again includes the appendix. The NIOSH has translated the full regulation and the appendices into Spanish, and they've translated the Appendix B into Korean, and they're planning to translate into additional languages. The Davis Western Ag Safety Center has also developed some handouts and that include additional graphics and a simpler explanation of the information in the Appendix B in both English and Spanish. And if you're doing training, these are intended for agricultural workers, but I think they would be useful for helping to plan training for any workers. And of course, we work a lot with farm workers and day laborers, and in working with a population of immigrant workers who do a lot of seasonal work with, different employers. There are a number of things to keep in mind. The population tends to be very low literacy in any language, so it's important to have oral training low literacy materials with a lot of graphics that are culturally relevant if possible, and to have, you know, a real life demonstration if possible of how to put on the respirators. If that isn't possible, you know, we're hoping that some short videos are going to be produced that could be used maybe on a tablet out in the field for helping to explain how to use respirators. And this could be particularly important for workers who speak the indigenous Mexican and Central American dialects, because those languages are are not used in written form by workers, and there are multiple dialects. So, you know, we are hoping that some short videos can be developed in multiple dialects for helping to train these working populations. There are also phone translation services and some community groups that can help with training Indigenous workers. And in training, it's of course important to respect people's cultural practices. In agriculture, it's, you know, very common to use a bandana to protect from the sun and from dust. And, you know, it should be approached in a way, which I think the Western Center's materials do, where you explain that the bandana will let the smoke come through, so that's not why it's not good for this, but not trivializing the use of the bandana. It's of course important to have a clear explanation of how respirators are important for preventing inhalation of smoke, but that they're not safe for some people who have lung and heart problems. And you need to keep in mind that a lot of these workers, unfortunately, have limited medical care access, so they may not know they're part of a sensitive population. It's really important to explain how the N95s get clogged over time and need to be replaced and shouldn't be kept for days on end. And of course, it's really important to encourage reporting of symptoms and explain the right to medical care for work-related illnesses for these populations in particular. And then I'll go into examples of some of the air quality in past fires. This is just a look back in general about how for the Northern California area here in particular, we see that between 2016 and 2017, the PM 2.5 exceedances of the level unhealthy for sensitive groups went way up. This is, you know, due to the fire in Santa Rosa area, most likely, and then some other fires in Los Angeles. It also, there was the fire complex in Los Angeles and Ventura. And then last year, of course, in November, there was the very terrible fire, the Camp Fire in the Paradise area. And this is a breakdown of the air levels in Chico, very close to the fire. And as you can see, the levels shot up to the hazardous level on the first day of the fire, and then remained at the unhealthy level for the most part, for 12 days following. And in other areas throughout Northern California, as you probably all remember, there were multiple unhealthy days throughout the Bay Area, as well as here in the Sacramento Valley, from the smoke from the fire, and several in each area, several days where the air quality was very unhealthy or hazardous. None of these levels went over 500 for a 24-hour average, but in the Chico and Butte area, there were several 1-hour exceedances of 500. And as I mentioned before, the temporary emergency regulation will expire in the middle of January, and so Cal OSHA has already started the advisory committee process for developing a permanent regulation. An advisory meeting was held at the end of August, and a discussion draft is available. Comments were taken until the end of September. Sorry, one moment. And for the permanent rulemaking, NIOSH prepared a discussion draft with both some very minor clarifying edits and then edits that would lower the threshold for offering respirators for voluntary use to 101, the level unhealthy for sensitive groups, and would lower the threshold for mandatory respirator use where fit testing and medical evaluation by a healthcare provider are required from 500 to 301. And the petitioners are very supportive of both of those proposals because there are, of course, many people who are working who are members of sensitive groups, and they need to have protection. In particular, for lower income workers, they may not know that they have asthma or some other sensitivity where they could benefit by use of a respirator at a lower air level, and they should be entitled to it. The proposal, as written by OSHA, would require workers to ask for a respirator at the levels that are unhealthy for sensitive groups, and we think that it should be simplified that they are just provided for voluntary use at that level rather than having a distinction. Oh, excuse me. Sorry. As I mentioned, some of the ongoing discussion is about, how to best protect workers who are part of sensitive groups, the appropriate threshold for mandatory respirator use. There's also, when you read the regulation, you will notice that the workers who are involved in emergency response are exempt from the engineering and administrative control requirements. And we have concerns that the way emergency work is defined is a little too broad. It should be work under the incident command, we think. And then there are some administrative controls that can be used for some emergency response work. So we think the exception is also too broad. There's also work underway to try to figure out what the appropriate type of filtration is to be effective against wildfire smoke in indoor situations, and also, how often it needs to be maintenance needs to be performed. And I think that is something where NIOSH could use more input if anyone has special expertise in that. And then finally, of course, when you're involved in this, you're going to need to look up the PM 2.5 air levels. As I mentioned, the air.now website is a great place to look them up. It has both current and forecasted AQI levels, and AirNow also has an EnviroFlash alert system you could sign up for to get alerts when the air quality is unhealthful for sensitive groups or unhealthy or worse. Many local air districts also have email alerts that you can sign up for. And there are various private apps around, but if you're using one of those, you need to make sure they're using reliable air monitoring data, because some use the purple air monitors, which are not considered adequate for this purpose. They haven't been calibrated, and they may not be sensitive enough for PM 2.5. Also, whenever you're checking the websites or alerts or apps, you need to keep in mind since there is AQI information available for ozone and PM10 as well as PM2.5, you just need to make sure you're looking at the right number. It's usually pretty straightforward. Anyway, this is how you sign up for the EnviroFlash email or text alert. So it's pretty simple. And then lastly, it's important to ensure that your employer is aware of the requirements under this regulation, and to review the appendix, especially the way for communication, for the training requirements, and having and to have a supply of N95s ready for voluntary use, preferably a range of styles or several styles. It's important to follow the AQI for PM2.5 for your different workplace locations. Some of the apps may have a way to sign up for more than one location at once. And then, of course, integrating wildfire preparedness into emergency work preparedness plans is more and more critical. Another issue with the people who may be involved in evacuations, in emergency response, we feel that the regulation should include information on accounting for whereabouts of those workers, and so it's important to keep that in mind when you're developing any plans. And then also there will be further opportunities to participate in the NIOSH Advisory Committee process, and I provided the link where you can look for and sign up for information there. And I guess I went kind of quickly, so we can do Q&A now. Thank you.
Thanks, Anne. I hope everybody can hear me a bit better. I apologize for my bad mic earlier. But please do enter any questions you may have into the Q&A section of your Zoom. And in the meantime, we have some questions that folks have already shared. So while you're thinking of some for now, I'll go ahead and go through some of these questions. The first one, Anne, is in the rule, it says it applies when AQI is greater than 150 and that there's an anticipation of exposure to wildfire smoke. But what if the AQI is greater than 150, but there is no wildfire? Does the rule still apply?
No, the rule is intended to be limited to times when there is wildfire smoke. The wildfire may not be responsible for the entire AQI level of PM2.5, but where it's heavily influenced its rise.
We have another question about whether your slides can be shared. And yes, we are planning to share all the slides. We will be able to email the slides out to everybody who attended.
Good, then you'll have the links to the different materials.
And then another question is somebody had asked for training. Can we just give our employees Appendix B? Is that adequate?
No, it's not adequate. Training needs to include a presentation of the material and an opportunity for workers to ask questions and get them answered. And that's written into the regulation. And, and as I mentioned, many farm workers and other low-income workers have very may have very low literacy. So for them, the regular presentation and training is all that more important.
There's another question about the unit of measure for particulate matter. And I think the unit of measure for fine particulate matter PM 2.5 is micrometers. Is that
yes, I was going to include a slide like that and I didn't, but the levels, and I'll try to go back here. The levels here in the AQI, in the index, they correspond to certain ranges of micrograms per meter cubed. And in the actual regulation, there's a table that shows the levels they correspond to. And if you go online, it like everything else now, they have a conversion too. But yeah, so for example, for the air quality of 151 corresponds to a PM 2.5 level of 55.5 micrograms per meter cubed. And then a level of 301, the AQI of 301 corresponds to a PM 2.5 level of 250.5 micrograms per meter cubed. And that's in the Appendix A, which I did not cover, but if it is possible for an employer to, instead of relying on the Air Now or Air District data, it's permissible to do your own monitoring of the PM 2.5 levels if you have a monitor that is of adequate quality and calibrated, which those are fairly expensive, but they are available.
Somebody else had asked about, is there a range of N95 respirators to offer employees, or is just the one particular brand okay, or do you know anything about?
Well, for the voluntary use at the less high, shall we say, air AQIs, the provision of one model is acceptable according to the standard itself, but it is well recognized that people with certain facial shapes, if you have a narrow chin or a particular large face, the one one model isn't going to fit absolutely everyone. So it is good to have several sizes or models available to be sure that you can really protect workers from known hazards. It doesn't necessarily have to be more than one brand, just more than one multiple shapes. There are foldable ones, there are the duckbill ones, and then there are the more standard ones. And I could go back to that.
Do you know, say about somebody who's with asthma, do they have, would they be able to use N95s?
Yeah, many people, it would sort of depend on how severe your asthma is, but many people who have asthma would benefit from use of an N95 and would really benefit more if it was provided at the level that's unhealthy for sensitive groups. That's what that advisory is intended for. So, that's why we think the threshold should be 101, and we would encourage people to provide, make respirators available at that level. And you have to keep in mind, not everybody really understands whether they have asthma, and some people would feel funny asking for a respirator at a lower level. So, we encourage just making them available at that lower level. But you also need to keep in mind that the best way to reduce exposure is to try to relocate the work to a less hazardous area, either indoors or in an area where there's less smoke, because some people with asthma can't tolerate any smoke exposure or may have trouble with the breathing resistance from a respirator.
Yeah, and I noticed in the standard it says that employees with lung or heart problem consult a physician. But I was wondering about just sort of barriers for farm workers in accessing healthcare, and if that
Yeah,
might be a
that's
problem.
a really big problem. So that is an area where, you know, it's a general piece of advice that doesn't really isn't really adequate. So that's why you know, we think that both providing respirators at a lower air level if possible, and then also encouraging people to report symptoms and taking them for medical care if they or you know, removing them from exposure if they're developing symptoms is really important.
We have another question asking about whether is there no requirement for fit testing the respirator, and most models cannot be fit tested.
Well, there is, once you get to the mandatory use level, then you are required to do fit testing and to administer to have a full respiratory protection program, which would include fit testing and administering the questionnaire to be evaluated by a healthcare provider, which, you know, looks at risk factors people may have that could contraindicate using a respirator, like if they have a heart condition or a COPD or something else like that. But when use is voluntary, those the fit testing and the medical evaluation aren't required. And it is harder to fit test an N95 than, say, a elastomeric respirator, because, you know, the positive and negative fit test doesn't really work. But it is possible to do. Fit testing is done with N95s using the saccharin spray method, and with the N95s, you know, part of the fit testing is figuring out if the standard model really fits your face, or if you need to go to a duckbill model. I should go back to that again, or some of the folding models fit people better. So, you know, for people who use N95s, you know, in healthcare settings or in some construction or pesticide application settings where it's mandatory, they do have to be fit tested. So anyway, the first picture here on the left is the duckbill type, and it's supposed to be better for someone with a narrow chin. And the valves are really good for, it's a little more comfortable and cooler, but they also don't always fit based on where the valve is located. They may not fit real well for someone who has a larger nose. So it's just, you know, different, you know, one shoe doesn't fit everyone, one respirator doesn't fit everyone.
And are the employers fully responsible then for purchasing and providing the respirators for voluntary use and also replacing them as needed?
Yes, the regulation clearly states that you need to have a sufficient number of respirators for all the workers, you know, so that all workers, so if all the workers on the crew on a shift want to use respirators, they will be able to. So the employer definitely has to provide them once the air level is at the unhealthy level now, and that may be reduced to the unhealthy level for sensitive groups due to wildfire smoke. It's certainly highly recommended, if not required, that the that they respirators, these are disposable respirators, that you get a new one at the beginning of each shift. I think it's a little, so that would be, one a day and you also need to have really a few extra around in case one of them gets, you should have quite a few extra around because, they can get dirty for one reason or another. Also, if the smoke level gets really high, they could get clogged before a full shift is done. And then they're not only unprotected, they're hard to breathe through at that point.
Do you know as well, does wearing an N95 increase risk for heat exhaustion for these outdoor workers? And is that something they should sort of be aware of too?
It could, to some degree, increase the risk of heat exhaustion. We are also, one of the, we strongly recommend that people increase the frequency for rest breaks, and also try to reduce the pace of work when respirators are used. And we've advocated for an hourly relief break while using respirators to have that added to the permanent standard. So that is one way to address that.
I have another question. How do you determine exposure dose for voluntary use? I'm not sure I understand the question. How do you determine exposure dose for voluntary use is moved work indoors? Sorry. Maybe that person could ask the question again. Just not sure, unless you understand what that means, Anne. Yeah.
Well, I think, if someone is working indoors in a building without mechanical filtration, we really don't have a good way of knowing what the AQI, what the PM 2.5 level is in that environment. We just have to assume that it is the same as outdoors, at the nearest air station, which I have not actually seen the data, but I have heard that that in some cases the air levels could get even higher in a indoor location, say where the bays are open in a warehouse or something, because the smoke could kind of get trapped there. So so the simple answer there is just you need to assume the air level is whatever the closest outdoor station level is, I believe.
And another question is, what would you recommend for workers who don't want to wear a respirator?
Respirators are not comfortable. I completely understand. It's really important that they monitor their, whether they are getting any symptoms from smoke exposure, and reconsider if they are, or report the symptoms. Of course, the better way to deal with this is to try to reduce the number of people who are working in areas where the smoke levels are high, to just the really essential work.
I remember that you had said that the regulation applies to outdoor workers like farm workers and day laborers, but does it also apply to federal workers as well as private or state workers?
Federal workers are not covered by Cal OSHA standards because they are federal, not state workers.
Okay.
But that said, they are covered by the general duty clause to protect them from known health effects. So it is not explicitly required, but it is highly advisable to give them protection because there have been cases where someone has made the case that they were not being protected from a known hazard, which they should have been under the general duty clause.
Also, there's a question about compliance. How will compliance be monitored for the regulation?
Mm-hmm. Well, Cal OSHA will respond if there are complaints, from workers or people who see situations where it looks like workers aren't being protected outside. And they also hopefully will have the resources to go out during smoky conditions in areas where the levels of PM 2.5 are high and, do checks to make sure workers are getting protection.
So I guess the Cal OSHA workers will have to be careful of wear their respirators too.
Right, when they aren't in their air-conditioned, in their air-conditioned vehicles, yeah. Well, I think they've mostly probably been fit tested, so.
And so given the sort of way employment is with many subcontractors,
Mm-hmm.
then who gets held responsible for non-compliance? And do you know what the penalty would be?
Well, the person, sometimes you have a joint employer situation because you may have a contractor who's directly hiring the workers, but if, say, the grower is saying, directing, you have to harvest this vineyard even though it's close to the smoke because we got to get it harvested, then it would be a joint employer situation, and either or both could be cited. And I don't know what the fine levels would be, but I would think that some of these could be serious citations because, as we know, inhalation of high levels of PM 2.5 can increase the risk of a lot of lung and heart problems because the PM 2.5 goes deep into the lungs and is absorbed into the bloodstream. We did hear reports of some of the workers outdoors during some of the extensive fires getting pneumonia and just, coughs that lasted a long time.
Do you know are the AC filters in cars, then do that protect people from exposure in wildfire?
I think that is something that really needs to be researched more. And I know Cal OSHA was looking at, whether the standard should be what is called a MERV filter, for buildings and I don't even know if those are available for cars, but no, I think that is a very good question, and it's something that needs to be researched. There's also the issue of if you're doing work and you have to keep opening your window for some reason for safety, then that's, your car window, that's going to be an issue. And you should have, I think, workers who have to drive around should at the very least have a respirator available. They may not need to wear it all the time, but they should have it available.
Just thinking generally about climate change and its sort of prediction to increase wildfires frequency and intensity, is it likely that the standard will have to be updated, or does that happen with standards once writ that they can be changed? I don't know.
Certainly. That the outdoor the standard for prevention of heat illness in outdoor workers has been modified several times to strengthen it. And it definitely can and does happen. It's not always a super fast process, but it does happen.
And is there anyone who gets excluded from the regulation?
Well, this regulation currently excludes the firefighting workers. They are covered under other regulations. And then it has some exceptions for workers who are doing emergency response work. There is an issue that came up during the advisory meetings that utility workers, when they're working near the live lines, there's a hazard called arc flash, and it's you obviously shouldn't be wearing a flammable respirator when you're doing that work. We think that the solution is just, you should wear the respirator when you're doing other work and not when you're doing that work. It might be possible to wear a shield over a respirator, but that could be a real heat stress issue. Otherwise, then there is, as I mentioned, there is an exception from the engineering and administrative controls for workers who are doing evacuations, helping with evacuations and other emergency response. And we think that is a little too broad, that because, you may be able to cycle workers sometimes. You may not be able to, and you definitely need to have a system for accounting for workers in that kind of situation.
So in January, when the temporary regulation expires, what happens?
Well, given that, Cal OSHA is hard at work on this, I'm almost positive there will either be a permanent regulation put in place at that point, or the temporary regulation could get renewed while the final touches are being put on a permanent regulation in the next 6 months.
What do you see as being the sort of biggest challenge to implementation?
Well, getting the information out. We are working in making sure the information reaches all workers. We are the Labor Occupational Health Program at UC Berkeley got a grant for developing a model program for field workers, and we will be working with them to help develop and field test that program soon. With any new regulation, it's sometimes there are unforeseen issues that have to be addressed as they develop. But, I think this has gone through a really good review process. Sorry, I may have have lost the thread there. Sorry.
That's good. I think you answered.
Okay.
I think the only final question is just given that I'm not sure what percentage of this audience are nurses, but it may be higher than lower. Do you have any particular kind of recommendation for the occupational health nurse that you would like to share to them while you have a captive audience?
Well, I think just to try to encourage reporting of symptoms and recording of symptoms so we can get an idea of how well the regulation is working. The more healthcare providers who are trained in how to do the evaluation of the questionnaires during the medical evaluation, of a respiratory protection program, the better, and to do fit testing. I think those are all really important issues. And if, you know, if you find in your work that there are certain respirators that seem to fit better than others, you know, it's good to get that information back to maybe the DPH Occupational Health Program, or I've given my email. I welcome feedback so I can, you know, try to take into account as we move forward.
Great. Well, thank you so much. And I hope that we'll be able to continue this conversation and have some more webinars, maybe in follow-up after the standard is permanent standard comes into place, and perhaps some examples from nurses and what they've done in their workplace. But so please, everyone listening, stay tuned for future webinars. And in the meantime, I don't think there's any other questions, so I just wanted to say thank you very much again to our presenter for helping us in this great way and sharing all your expertise. It was very, very helpful and a good opportunity for us to take a look at the standard. And also thank you again very much to COEH for supporting us and hosting this webinar. So
yeah, thank you guys so much for joining us. And again, thank you, Anne, for presenting, and CCRON for organizing this as well. If you want a recording of this webinar, we are going to make that available on the website. It'll be at coeh.berkeley.edu, and we'll also have it on our YouTube page. So you can find the recording there. We'll be sending out evaluations after the webinar, so make sure you check your email for that evaluation. And yeah, thank you all so much for joining us today. I hope you have a wonderful day. Oh, and if you want a copy of the slides, you can email coehce@berkeley.edu. Again, that's coehce@berkeley.edu, and we're helping to distribute the slides.
thank you. Thanks, everyone.
Have a good day. Bye-bye.
Bye.